it feels really good right now.
Like it can breathe or?
Yeah. Like I usually feel like I constantly need to pop them, but they don't pop.
All right, what you got going on?
My hands and knuckles have been hurting after I lift weights. These knuckles hurt, and then these from holding weights, but then when I work, they hurt. And then from also working, this wrist feels unstable, and then this middle finger will get stuck like that sometimes, and I've had to try and pop it out.
And what else do you do for work?
I'm a pelvic therapist.
So your main complaint is finger gets stuck and feels unstable.
Feels unstable here, and so then when I have to lift, it feels like my hand is dislocating from my wrist.
So we're going to see what this can do, the scraping and the gua sha.
Let me scoot towards you.
So basically this would be a possible tendonitis, overuse injury. She's never really had any major injury or anything like that to the wrist other than having to hold
this position for a long time.
Prolonged positions. So I'm just going to start off and see where we have crunchies. Because I'm going to check out everything. How's that feel?
It's kind of tickly right now.
And you can hear the crunch. Some people are like, is that normal? Yes, to a certain degree it is normal. But there are times when the muscles get really overworked and you'll feel or hear more of it. Got a lot of shoulder range of motion.
The hardest thing is holding my shoulder in this position.
She has chronic bilateral adhesive capsulitis of both shoulders. Very mild.
That cannot be fixed with scraping.
No. But I'm only going through layer 1, layer 2. I'm not pushing real hard just to show on her how hard I'm pushing. It's about that much pressure. How much pressure does that feel like?
Nothing.
But because we're using the tool, it's a much more concentrated pressure. You can see right in there through, this is the carpal tunnel. These would be the flexor tendons of the forearm. See, it's really starting to show up. Is that painful?
Shooting down into my hand.
So with
Plus
this,
my arm's tired.
well, you can turn it. So right here on the forearm, median nerve goes right through there. So you will feel tingles down into your hand. Other parts of the body, like the shoulder, knee, the back, the nerves are generally much deeper. So you don't feel a lot of the shooting sensations. The calf, you really feel a lot of shooting sensations down into the leg and foot.
I'm super ready for you to be done.
She's been one of the best patients I've ever had. And this is a very common one to where after you do it, your hand actually feels
itchy.
Weaker.
My hand itches really bad.
So we're going to do a little bit more there. So right in here, carpal tunnel now. Trying to free up as much as we can because there's congestion here, inflammation. Things are not functioning as well as they should, and thus she has that weakness. It feels unstable. Work that carpal tunnel over. This is generally a much more tolerable spot. Sometimes it will even be like a good hurt or a good discomfort.
That doesn't hurt at all. That feels nice.
So you want me to go back here?
No. I gotta put this.
Right there in the thumb muscles. No matter what, I pretty much always check that out on people because there's usually something there in the thenar, thumb muscles. What are you feeling with this one?
Nothing. That just feels good. Just looking at that vein on my wrist.
Bet you're an easy stick.
Oh, for sure.
So I've been doing this for a couple minutes. Move your hand around.
Feels good.
In what way?
I don't feel like catchiness. A lot of times when I do this, I can feel almost like this tendon will catch in my hand.
And so I haven't even went into the finger tendons yet. I've only done here and then the carpal tunnel and a little bit of the thumb. So we're still going to explore because we have phalanges, like our fingers. Imagine our fingers extend down into here before they hit the carpal bones. So I'm going to check right along those tendons because there's basically a little pulley that allows you to contract your fingers without that tendon going. So I'm using this little guy just to simply check, not using a ton of pressure, for the little muscles in between each of those bones. Feedback I'd look from her would be, does that feel sore? Is there any pain with that?
No, it feels like there's a little knot in it.
What about over there?
No, it's not.
What about there?
It just feels knotty.
So instead, nothing in between each of those. Now I can take this edge and just do the whole palm. How's that doing?
It actually feels good. It's making my other hand hurt.
But really right now what I'm doing is I'm targeting, because I'm using this bigger edge, I'm not getting to the deeper muscles. I'm not targeting the deeper muscles in between each of these bones that I'm talking about. I'm trying to get the tendons that actually sit on top of it. Those tendons that allow her to contract and flex her fingers. Did you do a bicep workout today? That's nice. So after spending a minute or so, 2 minutes on that, be done. Let her test it out.
Feels good.
And so we could be done with that. In some situations where people have a trigger finger, a true trigger finger where their finger gets stuck, show them the position. Their finger will get stuck like that. That's a trigger finger. There's more specific names for it, but that's basically a trigger finger. I would actually go into the entire finger itself. But since she's so tough, we're not going to do that.
Well, and I think some of this comes from, I have a big scar at the joint line. I think that gets stuck sometimes.
What's that from?
Getting slammed in a car door. I broke my finger.
So let's see, just for fun. Does that sore at all?
No. There's not much feeling in it.
Nothing major with that?
No, but I like it.
Do you like it? When you get into the fingers and the hand, you have to rely a lot more on patient feedback than true tissue feedback. When I'm doing this on somebody's knee or shoulder, you can feel the big muscle groups just kind of soften out. But here on the finger, there's so many bones, tendons, ligaments, tiny muscles. You really have to just go off of patient feedback. So then I would try just to explore and see, because the muscles, again, in between those bones, you can see them a little better here. There's a bone, and I'm going to go right in between. I'm going to go right in between each of those bones for the muscles in between there.
That's tender.
So even though she didn't point to that area, I'm still going to get in there and try to free that up as much as possible. That's just like any other overused muscle. And I'm using this little edge right here. This one, I don't even know what it's called. I think this is a bitty. Very similar to a situation where if you have a muscle knot or a trigger point and we just have that innate urge just to mash on it.
That's reproducing the pain I feel after I hold dumbbells.
So ideally, we want to try to go until the discomfort of the scraping does not feel as uncomfortable as it did when we first started. She's fine. How's this feeling?
Good.
Not as painful as it was?
No, not even.
Good. Move that around, and then I'm going to check one more area over.
That's not as bad as the first one, but it's tender. I actually bet over by the pinky. The next one over, I bet that's worse. Actually, that's hurting more now.
So I'm still going to hang out there. Even though it took a minute, if there's pain with it, there's dysfunction. How's that doing?
Good.
You're supposed to let me know when it decreases.
Oh. That one feels yucky.
So I'm between the 5th and the 4th phalange.
I think that's the worst. That's by far the worst.
So she's just supposed to let me know if I'm using too much pressure. Pretty much right now I'm using the weight of the tool, but it sure doesn't feel like it on her end. Me, I feel fine.
Have you ever felt stronger hands?
I never have. Probably never will.
Probably.
So on my end, I can actually feel this one kind of flatten out. I'm not going to say soften, but it just doesn't feel like it has as much of a bump. But the bump is still right there. How's that doing?
It's awful.
So if she needs a little break, a little snack break, she can take a little break, and then we can go back at it.
It feels really good right now.
They can breathe or...
Yeah. Like I usually feel like I constantly need to pop them, but they don't pop.
You're fine. Hang in there. We got to get it out. It's dysfunction, cytokines, substance P, interleukin. The blood flow to help with that.
I feel like you're right on the ulnar nerve, though, and let me tell you how terrible that is.
It probably is.
Honestly, it does feel really good.
So maybe if we're lucky, she'll follow up with us and let us know how her next week goes.
Perhaps. Thank you.
And that is a very simple process of what, there's more details than that, but a simple process. Somebody comes to me with hand pain. Hand pain is very hard to treat because what all do you stretch? I mean, you have like 6 things that you can do. You can stretch backwards, stretch down, try various finger stretches. You can do a little massage, but the hand is very limited on what options you have as far as exercises go. That's why anybody with hand or wrist pain, I go a lot to these because there's so little that you can do therapeutic exercise-wise for them.
Thanks, Booze.
You're very welcome. Oh, here you go. Here's a towel.
Thanks.
clean yourself up. And that's the end.